So as I was telling you about newly synthesized inflammatory mediator, the most important topic is the cytokine, right? So now we are going to discuss about cytokines, right? So what are the cytokines? Cytokines are soluble proteins, right? So this is the important thing we have to understand. What are the cytokines? Cytokines are soluble proteins, and these soluble proteins are synthesized by which cell? That is another important thing, right? Okay, what are the sources of cytokine synthesis? Sources of cytokine synthesis. So it is synthesized by, cytokines are synthesized by which cell? So it is synthesized by both hematopoietic as well as non-hematopoietic cells. So both hematopoietic and non-hematopoietic cells will be having synthesis of this cytokines, right? Another important thing which we have to understand is cytokines are highly specific. Many times we feel that cytokines are non-specific, but never think like that. That is a confusion. So this is how it is given in immunology textbooks also. Okay, cytokines are highly specific, and this was the PGI question also. Cytokines are highly specific. So this point we must keep in our mind. They are highly specific, right? And to prove that they are highly specific, I will give you some of the example which examiner had asked in exams. For example, when you talk about cytokine interleukin 2, interleukin 2 is required for growth of natural killer cells and lymphocytes. So these are required for natural killer cells, which is a lymphocyte, or we can say lymphocytes. So natural killer cells and lymphocytes growth will require interleukin 2. So it is specific. IL-2 is for NK cell or lymphocyte, not for eosinophil. Same way, when you will see interleukin 4, this was all India question in 2015 and 16. IL-4 is required for mast cell. IL-4 is required for mast cell. So this is another great example which shows specificity. So IL-4 is for mast cell, not for the eosinophil. So when we talk about eosinophil, what should be the marker? IL-5. So interleukin 5 is the growth factor for eosinophil. Eosinophil is by interleukin 5. Same way, you can see that interleukin 6 is for plasma cell. Interleukin 6 is for plasma cells, right? So plasma cell is decided by interleukin 6. So now you can see this is the specificity. So IL-2 for natural killer, 4 for mast cell, 5 for eosinophil, 6 for plasma cell. And in All India exam 2017, there was a good and new question, and that was interleukin 8. Interleukin 8 is for neutrophil chemotaxis. Neutrophil chemotaxis. So that is very important to understand. IL-8 is for neutrophil chemotaxis, as you have seen in discussion of neutrophilic extracellular trap. If you remember what I have said that time, because of the bacterial antigen exposure to the neutrophil, or because of the IL-8 exposure to the neutrophil, neutrophilic extracellular trap will be formed. So that is also one important thing which we have to keep in mind. They are also required for neutrophilic extracellular trap formation, right, which is formed by neutrophil, right? So that is the important thing regarding cytokines, right? Cytokines, there are another group of cytokines which are having a smaller molecular weight. Such cytokines are called as chemokines. So this is another important variant of the cytokine which are called as chemokines. So what are chemokines? If you look at the name, this name is an informative name. Name is revealing information. What information it is revealing? Chemokine. So these are the small molecular weight cytokine which is required for chemotaxis. Name itself is telling chemokine. Kine means movement. Chemotaxis. So smaller molecular weight. So what are the chemokines? They are small molecular weight containing cytokines, which are associated with chemotaxis, which are associated with chemotaxis. So that is important. A small molecular weight required for chemotaxis, they are called as chemokines. Chemokines, they have been divided into 4 families. So here I will tell you the chemokine has been divided into 4 families. So chemokines, so I'm writing about chemokines. So chemokines are having 4 families. One is called CXC. Second family is C chemokine. Third is just C chemokine. Right? Second is CC chemokine. Third is C chemokine, and fourth one is CX3C chemokine. So these are three types of chemokine. Oh, sorry, 4 group of chemokine. So these are 4 families of chemokine, right? Alpha chemokine is another name for CXC. CC is also known as beta chemokine. C is called as gamma chemokine, and there is no name for this family member, right? So that is how they are another name: alpha, beta, gamma, and CX3C chemokine. What are the members which examiner asks in exam is the members. So members of CXC chemokine is interleukin 8. Interleukin 8 is the member, and this is required for chemotaxis of neutrophil. This is required for chemotaxis of neutrophil. So that was the question in older All India NAIMS exam, right? So IL-8 belongs to which family? This was the question. IL-8 belongs to alpha or CXC family. So that was the question in AIMS and All India exam. CXC family, IL-8 belongs. And what is IL-8? It is for chemotaxis of the neutrophil, which was All India question, right? Beta chemokine beta chemokine is required for chemotaxis of all kind of cells. Chemotaxis of all cells except for neutrophil, right? Except for neutrophil. So who are the members of the beta chemokine? So beta chemokine members are, number 1, this was the older AIMS and All India question, eotaxin, right? Eotaxin is chemotactic for which cell? Eosinophil. You can see the name itself is telling, right? Eotaxin for eosinophil, right? So eotaxin for eosinophil. Then there is another one called rantes for lymphocytes, right? Rantes for lymphocytes. So eotaxin and rantes, these two members we have to keep in mind for CC or beta chemokine. Gamma chemokine, there is only one member. Gamma chemokine, there is only one member, which is called as lymphotactin. And lymphotactin is required for chemotaxis of lymphocytes. So lymphocytic chemotaxis. So lymphocytic chemotaxis is done by lymphotactin. So this is the gamma chemokine or C chemokine. CX3C chemokine, in this family there is a one member, and that member is fractalkine. So just remember this point, can be a future question. Fractalkine. So remember, I am emphasizing on this, can be a future question. Fractalkine is required for monocyte interaction with the platelet. So this is required for interaction of monocyte with platelets. So monocytes and platelet, these are the cells which are requiring fractalkine for their function, right? So these are the important thing. Interaction of monocyte with platelet will require fractalkine chemokine, right? So these are the 4 families of the chemokine, their members and their salient features, right? Now I am going to tell you a very important table. This important table you can write down as an extra edge information. You will get, definitely you will get some question in your exam from this extra edge information. So this topic extra age information is little factual, little conceptual, right? So it is having both things, but the most important thing what I'm going to discuss, here will definitely help us to understand many of the future concept of the pathology and other subjects also, right? So that is why I wanted to discuss this extra age information for cytokine topic, right? So here, number one, I will just tell you the topic is most important. Heading is most important cytokine. Most important cytokine. So what is most important cytokine? So topic is most important cytokine. So what is most important cytokine for fever? This was question in this All India exam. So now you can see this was the question. What is the most common cytokine for fever, which is also called as pyrogen? So most important cytokine for fever is interleukin 1, right? So interleukin 1 is most important cytokine which is for fever. There are some other cytokine also. What are other cytokines for fever? Other cytokines are interleukin 6, tumor necrosis factor alpha, interferon gamma, ciliary neurotropic factor, ciliary neurotropic factors, and prostaglandin E2 alpha. So now we can see these are the important things which we have to keep in mind. These are the important pyrogens. So these are all important pyrogens. So what I have written here, IL-1 is the most important. Apart from that, IL-6, TNF alpha, interferon gamma, ciliary neurotropic factor, and prostaglandin E2 alpha. And these are all important MCQ. But out of all these important questions in PGI AIMS All India exam this year, in 2019 All India exam, question was which is the most important pyrogen? IL-1 is the most important pyrogen, right? So this is the most important pyrogen. What is the most important cytokine for inflammation, acute inflammation? Most important cytokine for acute inflammation. So for acute inflammation, All India 2016, there was a question for septic shock. Question was for septic shock, right? For septic shock, All India exam 2016, question was for cancer cachexia. Cancer cachexia. So acute inflammation, septic shock, cancer cachexia, for all these things, tumor necrosis factor alpha is the most important cytokine. So answer will be tumor necrosis factor alpha. So that was the answer. So question in recent All India exam was cancer cachexia, TNF alpha, right? So you can see acute inflammation, shock, cancer cachexia, TNF alpha is most important cytokine. Coming to the fifth one, what is the most important cytokine? Most important cytokine for angiogenesis. That is another favorite NEET question, angiogenesis. Most important cytokine for angiogenesis. So this was the NEET question. For angiogenesis, what is most important cytokine? For angiogenesis, most important cytokine is vascular endothelial growth factor. So this is the question which had been asked in All India exam 2014 and 16. Most important cytokine for angiogenesis is vascular endothelial growth factor. Which is most important cytokine for fibrosis? Another All India question in 2015. Most important cytokine for fibrosis is transforming growth factor beta. So it is transforming growth factor beta. So most important cytokine for fibrosis will be transforming growth factor beta. Recently asked question in All India exam was what is the most important cytokine for granuloma formation? For granuloma formation. Most important cytokine involved in granuloma formation, and answer is interferon gamma. So remember, interferon gamma is most important cytokine for granuloma formation. What is most important cytokine for acute phase response protein synthesis? Acute phase response protein. right? So in short, I will be writing APR, acute phase response protein. Acute phase response protein. This was the question in All India 2016, a little bit controversial question also, right? But this topic is very important. Remember what I am saying, this topic is very important because there were questions from this topic in previous year PGI, AIMS and this year All India exam, right? So this topic is very important, acute phase response protein. So one by one I will tell you. Question was, which is the most important cytokine? Which is the most important cytokine for acute phase response protein synthesis? So your answer should be interleukin 6 is most important. Interleukin 6 is most important because whenever you will read your textbook, you will find it is interleukin 1 also, and it is tumor necrosis factor alpha. So all are required for acute phase response protein synthesis. But most important question is, what is most important? So your answer should be, out of all these, this one is the most important. This one is the most important cytokine, right? So most important cytokine, as I have written here, this is the most important cytokine. Other cytokines are IL-1 and TNF alpha. This is the one important point, right? Another clinical scenario wise, if you understand कि acute phase response protein, what question examiner can ask you, or what kind of concept you should have in your mind कि acute phase response protein will be increased during inflammation, or it will be decreased during inflammation, or both. So what is your thinking? Will it increase always? Answer is no. Acute phase response protein is altered during inflammation. See what I am saying here? See what I am saying here? Acute phase response protein is altered. They are altered. I am saying altered during inflammation. Altered during inflammation. So acute phase response protein are altered during inflammation. What is the meaning of altered? Altered means it can be increased also, or it can be decreased also. So these are two possibilities. Mean to say that during inflammation, acute phase response protein can be increased and there can be decreased also. When acute phase response proteins are increased, this type of acute phase response proteins are called as positive acute phase response protein. When they are decreased, these are called as negative acute phase response protein. So positive acute phase response protein, which we should always keep in our mind, is positive acute phase response protein example which you always keep in your mind is the serum ferritin. So serum ferritin is an acute phase response protein which will be elevated during inflammation. That is why in iron deficiency anemia, whenever you are going to check for serum ferritin, it will not be a reliable marker, because in iron deficiency anemia, because iron is important component of several enzymes in our human body, right? So if iron is low, enzyme activity will be low, so patient will be having some infection, and because of infection, serum ferritin will be high, because serum ferritin is acute phase response protein. So that is why in iron deficiency anemia, serum ferritin should not be considered as a specific marker or very important marker, because it will be increased if this iron deficiency anemia is having inflammation, and practically iron deficiency anemia will be definitely having some kind of inflammation, and that is why serum ferritin will be high. So that is why we should not rely on serum ferritin for diagnosis of iron deficiency anemia, right? So it's a positive. So it's a positive type of acute phase response protein. Another positive type of acute phase response protein is C-reactive protein. Another one is the fibrinogen. So fibrinogen is also one example of positive acute phase response protein, right? Previous year in AIMS exam, examiner had asked negative type, which of the following will be decreased during inflammation. So you would have seen, right, in your wards, when you are collecting the blood sample for a TB patient who is on some anti-tubercular drug, right? When you are doing LFT, in LFT you are seeing albumin is decreased, right? So albumin is negative acute phase response protein. So this was the previous year AIMS, PGI and All India question. Albumin is negative type of acute phase response protein. Another one is transferrin. So these are two important negative type of acute phase response protein, albumin and transferrin. So as I said, albumin was the question in previous year AIMS exam and PGI exam and already exam, right? So these are the important point about acute phase response protein. So always remember, acute phase response protein, they are altered during inflammation. They can be increased also, they can be decreased also. Now another important thing we have to understand, कि name is acute phase response protein, but it does not mean कि it will be increased always in acute inflammation. Acute phase response protein can be increased in chronic inflammation also. So that is the important point we have to keep in mind. Acute phase response protein can be increased in both acute and chronic inflammation. So it will be increased in both acute and chronic inflammation. So this point we have to keep in mind, कि it is increased in both acute and chronic inflammation. So don't get biased by seeing the name कि it is acute phase response protein. Keep in mind it is increased in both acute and chronic inflammation, right? So these are the important point about acute phase response protein, right? So we have seen acute phase response protein. Now we will see another important question, which was the question in AIMS exam 2014, which cytokine is most important for both morphogenesis, so both morphogenic and mitogenic. So which cytokine is both morphogenic and mitogenic? This was the question. So we have to understand what is the meaning of morphogenesis. Morphogenesis means organogenesis or embryogenesis. So which is involved in organogenesis or embryogenesis. What do you mean by mitogenesis? Mitogenesis means cell proliferation and differentiation. So there is a one cytokine which is involved in both morphogenesis and mitogenesis, that is called bone morphogenetic protein, BMP, bone morphogenetic protein, and that was the answer in AIMS exam. Remember, that was the answer for AIMS exam. Bone morphogenetic protein is both morphogenic and mitogenic, right? So bone morphogenetic protein is both morphogenic and mitogenic. But what future question can be asked in exam? Because BMP is a member of transforming growth factor beta family. So this point we have to keep in mind for future exam point of view. See, this is the older question in AIMS exam. So in future exam, examiner may write which is having both morphogenic and mitogenic activity. So that time you have to keep that in mind. TGF beta is having both morphogenic and mitogenic activity, and TGF beta family member is the bone morphogenetic protein. So bone morphogenetic protein is a member of TGF beta, and they will be involved in both organogenesis and mitogenesis, right? So this is the 9th point. Now the coming to the 10th and important thing, right? Which cytokine is anti-inflammatory cytokine? Anti-inflammatory cytokine, right? So which is anti-inflammatory cytokine, and what is the meaning of anti-inflammatory cytokine? This is very important to understand, because many people, they feel it is anti-inflammatory, they will prevent inflammation. That is why they are called as anti-inflammatory, which is a myth, which is a wrong concept. What is anti-inflammatory cytokine? Any cytokine which is antagonist of interleukin 1 or TNF alpha, they are considered as anti-inflammatory cytokine. This is the important thing we have to understand. Anti-inflammatory cytokines are any cytokine which is antagonist of IL-1 or TNF alpha. They are called as anti-inflammatory cytokine. What is the role of anti-inflammatory cytokine? Why examiner is asking this question, and how we are going to connect this in future immunology discussion, right? So anti-inflammatory cytokine, their main function, see, they are antagonist of IL-1 TNF alpha. Their function is to inhibit proliferation and differentiation of autoreactive or autoimmune cells. So autoreactive or autoimmune cells proliferation will be inhibited by anti-inflammatory cytokine. So they will be having tendency to inhibit autoimmune reaction. This is the number one. And number two, they are involved in or they are associated with wound healing and repair. So they are associated with wound healing and repair. So that is why these anti-inflammatory cytokines are important for us to understand, because they will help in wound healing, repair, and they will stop the growth of any anti or autoimmune cells or autoreactive cells. So they will stop growth of autoimmune cells or autoreactive cells, and they will help in wound healing and repair. So now we will see who are the members of this anti-inflammatory cytokine. So who are the members of the anti-inflammatory cytokine? So anti-inflammatory cytokines are IL-4, IL-6, IL-10, IL-13, transforming growth factor beta. So these are some of the names which are included in anti-inflammatory cytokine, right? Anti-inflammatory cytokine. Out of all these anti-inflammatory cytokine, there are certain cytokines which are both anti-inflammatory and pro-inflammatory. So IL-4 and 6 are both anti and pro-inflammatory action. So they are having both anti and pro-inflammatory actions, right? So that was the question in All India exam, which is having both anti and pro-inflammatory function, and answer was interleukin 4 and interleukin 6. So these are having both anti and pro-inflammatory actions, right? So these are about cytokines. So these important things we must keep in our mind and we must revise when we are going for exam. These cytokines are very important topic which we have finished just now, right? So we have seen all these newly synthesized. Now we will move to the next topic, and that was, next topic was plasma mediators. So if you remember, when we were discussing about plasma mediators, inflammatory mediators which are present in the plasma, they are called as plasma inflammatory mediators. In that plasma mediator, if you remember, one was the bradykinin, right? So number one was the bradykinin. Already we have read about bradykinin function, right? So nothing to deal with this. What I want to tell you, how bradykinin will be formed. Bradykinin will be formed by factor 12. Factor 12, clot factor 12, which is also known as Hageman factor or contact factor. Hageman factor or contact factor. This will be activated to form factor 12A. Hageman factor will be activated to form factor 12 activated form, right? This activated form of the factor 12, will convert, this activated form of factor 12 will convert prekallikrein to kallikrein. So this will activate prekallikrein to kallikrein, right? And this kallikrein will convert, this kallikrein which has been converted will be converting kininogen to kinin, right? So kininogen will be converted into kinin, which is bradykinin, right? So this is also called as bradykinin. So here example is bradykinin, right? So this is how bradykinin is formed. So bradykinin is associated with coagulation pathway, where factor 12 is activating prekallikrein to kallikrein, and kallikrein is then converting kininogen into bradykinin, which is a kinin, right? So this is about coagulation pathway, which is considered as a plasma mediator. So we can see that how this coagulation pathway is associated with inflammation, right? So that is the point we have to take from here, how inflammation is associated with coagulation pathway. Factor 12 is essential for synthesis of bradykinin, right? Now the second thing and very important point which we are going to discuss is complement. Second thing which we are going to discuss is the complement, right? So what are the complements? So first question comes to our mind, what are the complements? Complements are the protein which are synthesized from the liver. So these are the liver proteins. First, we have to understand these are the liver proteins. Now the second important question comes to our mind. These liver proteins are associated with adaptive immunity or innate immunity. That is also one important thing which we must understand. Complements are associated with both innate and adaptive immunity, right? So this is the line of Javed's immunology, right? So there should be no confusion for this point which I have said. Javed's immunology says innate and adaptive immunity both, right? Why it is associated with, or how it is associated with? Because complements and their products are associated with, so complements and their products are associated with regulation and development of B cell and T cell. So B cell and T cell development is associated with complements and their byproducts. So that is how we can understand a very new information. They are associated with adaptive immunity also. So complement is associated with both innate and adaptive immunity. Why I wanted to say like this? Because this is the older All India question which was repeated in this year PGI exam also. Innate immunity is associated with complement. So if examiner says complement is associated with adaptive immunity in future exam, one should know yes, answer will be yes, adaptive immunity is also associated with the complement, because their products are associated with development of B cells and T cells, right? So what are the complement pathway? Why we require complement? To damage a cell or cause cell lysis of the organism or the cell. How this complement will act, right? So there are 20 subtypes of the complement, so that is the different thing. What I want to tell you about complement pathway. So I wanted to tell you complement pathway. Complement pathway, they are of three types of complement pathway, right? So there are three types of complement pathway. Number one is called as classical complement pathway. Classical. So number one is the classical complement pathway. Number two is mannose binding lectin. Mannose binding lectin, right, which in short we will be writing MBL, mannose binding lectin pathway. So this is the second pathway, mannose binding lectin pathway, classical pathway, mannose binding lectin pathway, and the third one is alternative pathway. Third one is the alternative pathway, right? So these are the three pathways which we are going to see in complement pathways, right? The classical pathway, MBL pathway, alternative pathway. Classical pathway is associated or initiated by immune complexes, right? So this is important to understand. Classical pathway will be started by immune complexes. Immune complexes which is containing IgG immunoglobulin or IgM immunoglobulin. So IgG, IgM containing complements will be activating classical pathway. In classical pathway, what happens we will discuss later on, but beforehand I want to tell, in IgG there are subtypes of IgG. So only G1, G2 and G3, they will be involved in complement pathway activation, classical activation. G4, immunoglobulin G4 is not associated. So just to make a note of this point, immunoglobulin IgG G4 is not associated with complement pathway activation. So this point is very important for exam point of view, future exam point of view. Examiner can ask you which immunoglobulin, which is not associated with classical pathway activation, IgG1, 2, 3 or 4. So that time we must remember that IgG4 is not associated with complement pathway activation, right? So this is the important thing. Mannose binding lectin. Mannose binding lectin is associated with mannose, which is combining with, there is a mannose binding lectin which is present on the membrane, which will be combining with bacterial antigen, especially the sugar moiety, right? The sugar moiety of bacterial antigen will combine with mannose binding lectin, and this will start mannose binding lectin pathway. Alternative pathway is activated by microbial antigen, especially lipopolysaccharides. Example is lipopolysaccharides. So now we can see there are three pathways: classical pathway, immune complex mediated, then membrane binding lectin pathway, bacterial sugar moiety, and then alternative pathway by lipopolysaccharide of the bacterial surface. So this is how complement pathway will be activated. So how this goes on, we will discuss one by one. When we are talking about classical pathway, because of the IgG immunoglobulin or IgM antibodies, IgG immunoglobulin or IgM antibodies, they will combine with C1q complement, and then they will be activating C1q, C1r, C1s. So mean to say that immune complex will combine with C1 and they will activate them. After activation of the C1 complement, what will happen? After activation of the C1 complement, what will happen? This C1 will cleave down C4 complement and C2 complement. So C1 will cause cleavage of C2 and C4. C4, see this, what I am showing you here. Two things will be removed. What are those two things? 4A and C2A. This will be removed. So what will be remaining? C4B, C2B. So this will be remaining. So C4B and C2B will be remaining. Even in the mannose binding lectin pathway, right? When you will see this mannose binding lectin pathway, when bacterial antigen will combine with mannose binding lectin on the membrane, this will activate the same thing, C4 C2 conversion. So this will activate C4 C2 conversion, and same C4B and C2B will be formed. So this C4B and C2B, which has been formed here, this is called as C3 convertase. Remember, this is called as C3 convertase enzyme, right? So this is the C3 convertase enzyme. So just remember, if examiner asks these questions, right? Examiner has tendency to ask this question: classical pathway, classical pathway and mannose binding lectin pathway. What are the C3 convertase? So remember, C3 convertase for classical and mannose binding lectin pathway is C4B, C2B. This is the right answer, right? This is the right answer. Now come and see what will happen in alternative complement pathway. In alternative complement pathway, when microbe LPS, lipopolysaccharide, will be released from them, this will activate factor B. This will activate factor D. So factor B and factor D will be activated by lipopolysaccharide. And then there is one more thing which is called properdin. So these are the things which will be activated by lipopolysaccharide. So alternative pathway, factor B, factor D and properdin will be activated by lipopolysaccharide. And once this has been activated, there will be formation of B, right? And then this will be activating cleavage of C3. So complement C3 cleavage will be there, and because of C3 cleavage, what will happen? C3A will be removed, and as a result there will be formation of C3B, capital B, and there is small fragment B. So now you can see BB will come, C3B and B will be formed. So this C3BB is C3 convertase of alternative complement pathway. So remember these things. C4B is C3 convertase, and here C3B and BB is the C3 convertase of the alternative pathway. So through this pathway, means classical mannose binding lectin alternative pathway, C3 convertase is formed. C3 convertase for alternative and mannose binding lectin pathway is the 4B2B, and 3B2BB is the for alternative pathway, right? So what will be the function of this C3 convertase? This C3 convertase will be now causing cleavage of C3. So they will break down C3 in two. So they will remove C3A. So C3A will be removed, and after removal of C3A, whatever is remaining is C3B. So C3B is remaining, right? So now this C3B, which has been formed by C3 convertase, this will follow two different pathway. Again, right? Two different pathway. I'm making it easier. So one is the classical pathway and mannose binding lectin pathway. So when they are following classical and mannose binding lectin pathway, what will be formed? What will be formed? C4B. You remember? C4B, C2B, and now C3B is added into this one. So this is how this product will be formed. 4B, 2B, 3B. Same way, when you will see the alternative pathway, C3B will be added to the C3B, B, B. So this is the another product which is formed in alternative pathway, right? So alternative pathway C3BB and classical and mannose binding lectin pathway, this one. So what are these things which I am showing you in this boxes? These are known as C5 convertase. These are known as C5 convertase. So these are C5 convertase, right? So these are known as C5 convertase. So this is C5 convertase, remember? So C5 convertase for alternative pathway, C5 convertase for classical and MBL pathway, right? So what is the function of this C5 convertase? C5 convertase in both places, what they are going to do now? So we will see that. C5 convertase will cause cleavage of C5. So C5A anaphylotoxin will be removed, and the remaining thing C5B will be formed, right? So this is how complement C5B is formed from the C5 convertase. After that, C5B will be having accumulation of some other complements like C6, 7, 8 and 9. So in the end there will be formation of C5B to the C9. C5B to C9. What is this C5B to C9? This is also known as membrane attack complex. This is called as membrane attack complex, right? So this is how membrane attack complex will be formed, which is the main goal of complement pathway activation. This was the question also in AIIMS exam 2017. What is the terminal end product of the complement pathway activation? Terminal. See, the question is, what is the terminal end product? Terminal end product of the complement pathway. Answer was C5B C9, right? So C5B C9 is the terminal end product of the complement pathway, and that was the question in AIIMS exam, right? So what is the function of this C5B C9? C5B C9 is required for cell lysis. So they are required for cell lysis, right? So they will be causing cell lysis. and this is how complement will be playing their role in our inflammation, right? So they will be causing cell lysis, right? So that is by C5b C9, right? How they will do cell lysis? That was the question in All India 2015. What is the mechanism of action? This was the great question by examiner. What is the mechanism of action by complement, right? This cell lysis is because of what? They are doing the damage of the lipid bilayer, or they are punching holes into the membrane? That is the question. So this cell lysis is done by, this mechanism is by punching holes into the membrane. So answer is by punching holes into cell membrane. So they are doing this by punching holes into the cell membrane, and this was the answer in All India exam, punching holes into cell membrane. So now future question is, which of the complement is most important in punching holes? Which of the complement? So if examiner says that C5b, C7, 8, 9, which is most important in this punching holes into the cell membrane, then what should be the answer, right? So that time we should know that it is C9. Remember, amongst all these complement, C9 is most important. C9 is most important, and this can be the future question in exam. Why C9 is most important? Why C9 is most important? So for this, logic is C9 has perforin-like activity. C9 has perforin-like activity. So remember this point. I'm not saying perforin. I'm saying perforin-like activity, right? So C9 complement is having perforin-like activity, because of which, when you will observe, suppose I am showing you, this is a cell, this is the plasma membrane, and this is the lipid bilayer, right? This is the lipid bilayer which I am showing you. So as I said, what is the mechanism of action of membrane attack complex? Punching holes into the membrane. How they are going to punch holes into the membrane? With the help of this protein which is called as perforin. As you can see, the name itself is revealing perforin. They will perforate. They will perforate what? Membrane. So whenever C9 is activated, now they will act on the membrane and they will cause perforation of the cell membrane. And this is how they will be punching holes into the cell membrane by the C9, and after C9 punching holes, there will be entry of other complements like 6, 7, 8 and 9, which will cause cell lysis. So that is the mechanism of action of the complement, right? So remember this complement pathway, the end product C5b C9 membrane attack complex. In membrane attack complex, which is most important complement for cell lysis? If examiner asks you this question in future exam, always keep this in mind. C9 is the most important. Why C9 is most important? Because they will be having perforin-like activity which will perforate the cell membrane, and this will allow the entry of other complements which will cause cell lysis, right? So this is how cell lysis or microbial lysis will be done by membrane attack complex. And whenever membrane attack complex is defective, whenever membrane attack complex is having defect, then what happened? Because they are lysing the membrane, so this membrane lysis will be affected, and that is why this patient will be having recurrent infection by capsulated organism. So this patient will be having recurrent infection by capsulated organism, right? So recurrent infection by capsulated organism, right? So that is why we have to understand this point. Okay, whenever there is a defect in membrane attack complex, patient will be having recurrent infection by capsulated organism, which examiner asks very frequently in exam. Which capsulated organism? Recurrent Neisseria infection, right? So this is the question which examiner asks very frequently in exam. Recurrent Neisseria infection is commonly seen in membrane attack complex deficiency or any capsulated organism. The point is capsulated organism. So capsulated organism, recurrent infection is common whenever there is a complement deficit or membrane attack complex is deficient. So these are the important points about inflammatory mediators, right? So now we are going to move to the next, and that is the chronic inflammation. So acute inflammation, either they will resolve or they will transform into chronic inflammation. So next topic we are going to discuss is chronic inflammation. What are the steps of chronic inflammation? So here we must understand chronic inflammation consists of three events, right? Number one, they will be having mononuclear cell infiltration. Mononuclear cell infiltration. So mononuclear cell infiltration will be there in chronic inflammation. Mononuclear cells. What are these mononuclear cells? It can be macrophage or it can be lymphocyte. Which cell is the dominant player in chronic inflammation was the question in DNB and All India 2015. Which cell will play the key role or dominant player? So who is the dominant player in chronic inflammation? So always remember, macrophage is the dominant player. So macrophage is the dominant player, and that was the answer in All India exam and DNB exam. So which mononuclear cell? It is macrophage. So because of the macrophage and lymphocyte infiltrate, when they are infiltrating the tissue, what they are going to do? What they are going to do? So these macrophage and lymphocyte, they are going to release cytokines. They are going to release cytokines when they are activated. So both macrophage and lymphocyte will release cytokines, and what these cytokines are going to do? These cytokines are going to perform tissue destruction. So this is the second event in any chronic inflammation, tissue destruction. So there will be tissue destruction or tissue damage, right? And after tissue destruction in chronic inflammation, third event will be repair. Repair or wound healing, right? So these are three important steps of the chronic inflammation, right? Mononuclear cell infiltration, their cytokines are causing tissue destruction, and then there is a repair by wound healing. So question comes to our mind, what is hallmark of chronic inflammation? So we have read hallmark of acute inflammation was increased vascular permeability. So same way, what is the hallmark of chronic inflammation? And we must remember tissue destruction. Tissue destruction is hallmark of chronic inflammation. Hallmark of chronic inflammation. So tissue destruction is hallmark of chronic inflammation, which we must keep in our mind, right? Hallmark of chronic inflammation is the tissue damage or tissue destruction. It is not granuloma formation. Remember, majority of the time I have seen students get confused with the granuloma. So it is not associated with granuloma. It is tissue destruction, right? So in this, as I said, the granuloma formation. So now we will discuss about this granulomatous inflammation. This granulomatous inflammation. Granulomatous inflammation, what I want to tell you here, okay, granuloma is a pattern of chronic inflammation. It is not the hallmark. Remember, it's a pattern. Granuloma formation is a pattern of chronic inflammation. So here we need to understand that this is the pattern of chronic inflammation. Pattern of chronic inflammation. So it is not the hallmark, it is pattern, because it will be seen in only some certain infections like TB, histoplasmosis, right? So that is why it is a pattern of chronic inflammation. So granuloma formation is a pattern of chronic inflammation. But this topic is very important. So here first I will describe what is the mechanism, what is the concept of granuloma formation. So what is the mechanism of granuloma formation? Because granuloma based question will be asked in your exam, and that time you should know how to identify the granuloma. And to identify granuloma, we should know the concept in the terms of mechanism, in the terms of their definition. So mechanism and definition will help us to understand how granuloma will be looking like. So in granulomatous inflammation, mechanism of granuloma formation, here I am giving you one example of TB antigen. Suppose TB antigen has come, right? TB antigen has come. So this TB antigen will activate which cell? It will activate macrophage. So TB antigen will activate macrophage. When macrophage is activated, what will happen? This will release cytokine which is called as interferon gamma. So macrophage will release one cytokine which is known as interferon gamma, and this interferon gamma will activate CD4 Th1 cell. This is very important to understand. In granuloma formation, which cell is involved? So it is Th1 cell which is involved. CD4 Th1 cell is involved in granuloma formation. So that is also one important thing we have to understand, right? So once this CD4 Th1 cell is activated, what will happen? They will again release interferon gamma. So CD4 Th1 cell will again release the interferon gamma cytokine. So if you remember, when we were discussing cytokines, that time I told you most important cytokine for granuloma formation. So now you can see that most important cytokine for granuloma formation is the interferon gamma. So that is why examiner had asked this question in all India exam. Most important cytokine for granuloma. See, TB antigen came, activated macrophage, which has released interferon gamma, which is again activating CD4 Th1 cell. Interferon gamma is again released, right? Now this interferon gamma will help in granuloma formation because they are having two important functions. Interferon gamma is having two important functions. So what are these two important functions? Number one, they are associated with lymphocyte proliferation and differentiation. So lymphocyte proliferation and differentiation is controlled by interferon gamma. So this interferon gamma will help in lymphocyte proliferation and differentiation, number one. And number two, this interferon gamma will convert or this will activate macrophage to epithelioid cell. So macrophage will be converted into epithelioid cell. So this is important to understand. What is the function of interferon gamma? Interferon gamma will activate macrophage. See what I am writing here. Interferon gamma will activate macrophage and they will convert them into epithelioid cell. How you are going to identify macrophage? Macrophage will be round oval cell, eccentric nucleus, foamy cytoplasm, right? So this is how we will identify macrophage. Round oval cell, eccentric nucleus and foamy cytoplasm. This is macrophage. And how we are going to identify epithelioid cell? They are elongated. So remember, epithelioid cells are elongated cell like this, like a slipper shape or chappal shape, elongated, and their nucleus will be in the center. So this is the important thing to understand. Okay, how epithelioid cells will be differentiated from the macrophage. When you will be able to identify epithelioid cell, you can identify granuloma very easily in your exam on seeing the histopathology image. Elongated slipper shaped cells are epithelioid cell, right? So this is the mechanism of granuloma formation, right? In this mechanism of granuloma formation, again I will sum it up. TB antigen has activated macrophage, interferon gamma was released, which was activating Th1 cell. Th1 cell has activated lymphocyte proliferation, Th1 cell has activated interferon gamma. So again I will repeat, I will summarize this granuloma mechanism. When TB antigen came, it has activated macrophage, interferon gamma was released. Interferon gamma has activated Th1 cell. So CD4 Th1 upon activation, they also have released interferon gamma, which has dual function. One is lymphocyte proliferation and differentiation, and second is activation of macrophage into epithelioid cell. So that is the mechanism of the granuloma formation. Before I move to the definition of the granuloma formation, I would like to give a salient difference between any epithelioid cell, because we read about epithelium and we read about epithelioid cells. So what is the difference between epithelium versus epithelioid? So this is about that thing only. So this brief table I wanted to give you to understand the basic concept of epithelium versus epithelioid. What is the basic concepts of epithelium? Whenever you find a cell supported by basement membrane, a cell supported by basement membrane. See what I am showing you here? I am showing you a cell supported by basement membrane, that will be called as epithelium, right? But when you are seeing a cluster of cells without basement membrane, so here you can see there is no basement membrane. No basement membrane, so this is called epithelioid. So that is why it is oid, epithelioid cell. Epithelium, cells supported by basement membrane. Epithelioid cells, cells without basement membrane, right? So what are the examples of the epithelioid cells in our human body? So examples are pancreatic islet cells, right? So pancreatic islet cells, testicular Leydig cells, and ovarian theca lutein cells, right? So theca lutein cells. So these are the three important examples of the epithelioid cell in our human body: pancreatic islet cell, Leydig cell, theca lutein cells, right? What are the example of epithelium? Example of epithelium I will give you about Brunner gland epithelial cells. So Brunner gland cells. So Brunner gland cells are columnar epithelial cells. They will be having column-like structure and they will be having basement membrane. So that was the question in AIIMS exam. Which of the following is not an epithelioid cell? See, this is the question. Not an epithelioid cell. Islet cells, Leydig cells, theca lutein cells, or Brunner gland cells. Now we can see answer was Brunner gland cell. Answer was Brunner gland cell. So this is how examiner will be asking. So that is why I wanted to tell you the basic difference between epithelium versus epithelioid, right? So now we understand this epithelium versus epithelioid.